Hereford's County Hospital has become the first in the Midlands to start using a new technology to reduce the discomfort of patients undergoing prostate procedures. Now, this is something that affects more and more men. 1 in 3 men over 50 have an enlarged prostate, which, of course, means needing to go to the loo more often. Traditionally, it was treated with drugs or surgery to cut out part of the prostate. This new treatment, though, involves using an implant to just hold the prostate back. It can be done under local anaesthetic and takes just 50 minutes. Michael Browning from Tarrington in Herefordshire had a prostate cancer diagnosis around 4 years ago and used to wake up 5 or 6 times a night to use the loo. He says since having the procedure, he now rarely wakes up at all.
I don't get up in the night anymore. I can usually go right through till about 7 in the morning before I need to get out to go to the loo. And I can go out and not worry where the loos are. It's not a cure. It's definitely not a cure because it doesn't solve the problem of the swollen prostate. It's basically to get rid of all the discomfort and the pain.
He says he was so impressed with the procedure that he's volunteered to speak out about his experience.
I mean, Mr. Mamalji first approached me and asked me if I would do this, like I'm doing for you now, and I agreed straight away. And he said that they're having trouble getting men, to come forward and give their opinion on what they've been through and this, that and the other. Well, that's just pride, and you have to learn to swallow your pride. You don't get to 66 by being too proud.
Here to tell us more about this is Neil Barber. He's the first surgeon to offer the procedure on the NHS, and it's at his hospital in Surrey. Neil, good morning.
Good morning.
How much of a game changer is this then? What was it like compared to the previous procedure?
Oh, it's completely different from some previous approaches, in that it was the first kind of truly almost day case / outpatient procedure that men could choose compared to more standard surgery, and it kind of crosses the boundary of choosing whether you might go down the route of tablets in terms of trying to improve your waterworks or more standard operations.
Is this for everybody though?
No, it's not for everybody. It's aimed at men. It's a sort of balance of in trying to improve your waterworks, but have a minimally invasive procedure that allows you to get back to normal activities very quickly in a matter of days and maybe the odd week or two, rather than weeks and the odd month or two, which is what you see after standard surgery. And also then men who want to preserve all aspects of sexual function, as that is under threat during standard surgery, and even to some extent that it's one of the recognised side effects of tablets.
And what's the cost difference? Is it cheaper? Is it more expensive? What's the cost implication?
Well, I mean, all hospitals work on a nationally recognised remuneration for doing a procedure, and that's weighted by geography largely, and also the age of the patient and comorbidities, like whatever medical problems they have. But essentially, the company have worked with the NHS to negotiate a tariff, as they're called, that is pretty much in line with what you would get for more standard surgery, a TURP or TURP. But in fact, because it's so innovative, because it's got so many potential advantages, not only for patients but for their healthcare system, there's an uplift. So the hospitals actually get paid slightly more than they would get for a TURP. So it's attractive not only for patients but also for the hospital.
So do you think we'll be seeing this rolled out nationally then eventually?
Well, I mean, it's there. I mean, it's badged up nationally. There's absolutely no reason why any department couldn't look to introduce it into their armamentarium of treatment options for men suffering with waterworks because of benign prostate disease. It's just a matter of a will to seek out training, and you do need to be trained, and then go through the process of introducing a new treatment technology to a hospital, which you can imagine involves a reasonable amount of painful paperwork.
And presumably this is only suitable, isn't it? Because I was just thinking, this, if you've got, say, prostate cancer and it's enlarged because of that, then that's a totally different thing, isn't it? That would need surgery, and you'd need to treat the cancer, wouldn't you? This is.
Well, yeah. I mean, the majority of prostate cancers, as in this chap, actually are indolent and don't really need treatment for the cancer. So what you're actually treating is the non-cancerous part of his prostate, which is the bit that's causing the symptoms.
Okay.
So I mean, that's a slight red herring in his case in terms of what was going on. The common event is that really us, unfortunately, as human males, as we get older, our prostates start to grow. It's just what happens. And in most men, at some point or other, it starts to cause symptoms by occluding the flow of urine out of the bladder. And then for some men, that level of symptoms is such that it causes sufficient bother that they go to seek advice.
Okay.
I think your patient was quite right to say that the habit of the male, and perhaps the British male more than others, is to put on a brave face, bury your head in the sand, and put up with it as some kind of badge of honour. Yeah,
that is very true, sadly, isn't it? Neil, we're going to have to leave it there. It's fascinating stuff. Good to hear from you. It's really interesting. Neil Barber there, who's offering that procedure on the NHS at his hospital in Surrey. It's just gone 7:45.
Travel update.
BBC Hereford and Worcester.
Here's what's doing.